What's up, What the Vet fam? Welcome back to this week's episode. Sorry about not having one last week. I was in Ice-mageddon in North Carolina, and then this weekend went through Snowmageddon. It's been really great times had by none in our neck of the woods. But on this week's episode, we are going to be talking about what we notice as veterinary technicians, veterinary assistants, and doctors notice when a pet walks into the exam room versus what the owner doesn't notice and what they're not here for. We'll do something that's more, I won't say simple to see, but it's going to be the nails. Nails was a big one when I posted that on TikTok, and it was more like they're curving into the pad, right? And now, mind you, I'm a bad technician I'm not even a technician anymore. But I'm bad in the sense that Allie Dog's nails, and I have no one to blame but myself because she's amazing for her nail trims. Hers are long. And my excuse right now is she needs her long nails because of Ice-mageddon that is currently outside. She needs to grip and up and down the hills. And that's my excuse. But they're not curling in like Rascals would because he was evil, and basically I'm guilty is what I'm trying to say.
You are, and you're trying to make excuses for it because you didn't know Ice-mageddon was coming before she grew in talons, my guy. I'm not over here being judgy, putting my fucking lip balm on, but I'm being judgy.
That's her nails right now.
Joy.
And she's amazing for her nail trims. Like, that's the thing. Like, I just put her on her back and I go click, 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 and she lays there. She's great. My real excuse is that they're somewhere buried in my car. And anybody that knows me and my relationship with my car says enough. I live in it. There's so much stuff. You never know what there's a crock pot in my car and an air fryer. We're digressing, but carry on. Go, Amber, go.
I have nothing. I can't say anything because I got the most random shit in my Jeep. I was cleaning it out the other day, and I found like 5 pairs of toenail trimmers. Do I use them? No, except for once a month for a client and 2 hours away. I've got my kayak paddles, my tackle box. I found some weird shit from conference in 2024. It's concerning, so no judgment here. But yeah, the nails I do notice quite a bit when we walk in the room. They're like, oh my God, I just trimmed them last week.
Or when they're coming into limping. Like, there's a reason why they're limping. And again, I put myself in this category because I had a Shih Tzu who was downright evil for nail trims, at least for me. If I came near him, he would then turn vicious when other people were trimming his nails. So I was the problem on that wholeheartedly. So again, I put myself in that category of being the problem.
Yeah. I mean, it is what it is. But yeah, no, I've noticed that a lot walking, into exam rooms for, a patient that's there for something totally different. And you look at the nails and they're like gripping the floor and their bone structure starting to change because they haven't had a toenail trim since Jesus was a fetus. You know what I mean? So that is something I see very commonly when I walk into rooms. I'm like, his fucking ears are rotten, but you look down, you're like, oh God. You know what I mean? Like, is he limping? Yeah. Is he walking funny? Is he chewing on his feet? Oh, okay.
Well, he's going to not anymore because we're gonna take care of that.
White toe, like you said, toenails growing into the pads, bro, with pus pouring out of it, smelling like death. How do you not? We were there kissing his feet and shit, smelling like a dead body. Like, how do you not notice that? It goes beyond Fritos, bro.
Feet.
I'm not talking about you. I'm talking about clients. Just, he's so cute. Bro, there's pus coming out of that hole where those nails are stuck in. Like, again, that's beyond the yeasty Frito smell of your dog's feet, my guy. That's like the equivalent of a body. Yeah.
We're gonna move on from the nail scenario, and we're gonna go to something that, because Amber and I came when we worked together in a specialty situation, like specialty practice. So pets would come in for lethargy, right? And so, but you're looking at the pet and the chest isn't breathing, but the abdomen is. Red flag. And it's not just, unfortunately for us, it's not a once in a blue moon scenario. It would happen several times a year where that would happen. And there's several reasons why that would be. We're not going to get into that portion of the program, but it would be one of those things where the dog's looking at you with help me eyes because they've added stress from a car ride, stress going into a veterinary office. So we've exacerbated the underlying issue already. And I remember it'd be like, has Fido been breathing like this? What do you mean? I'm like, well, you see how the chest is barely moving, but the abdomen is going like this. And they're like,
Yeah.
I don't know. I'm like, I have to steal your dog, and people are going to come with special papers that says you give us permission to go forward with emergency care
Yep.
because
And
they're
their
on the struggle
eyeballs are,
bus.
yeah, their eyeballs are bulging out of their head, and they're like, you're like, oh my God, he's smiling. He's so happy to be here. No, he can't
No, it's not.
breathe.
He can't breathe.
He's just so happy to be here. He'd probably be happy for some oxygen too, but
And maybe some chest x-rays to see what's causing the not able to breathe portion of the program.
yeah, yeah. We've seen that. Yeah.
Jaundice was a big one.
Mhm.
Like, I don't know why Fluffy's not eating. Well, how long has the eye color been different? What do you mean? Like,
Yeah,
I can get past like not noticing it on the gums and that because not everybody looks at their pet's gums and teeth on the regular, like us freaks of nature on in the veterinary world, right? Like, our dogs are
yeah,
used to having everything, excuse me, everything looked at routinely.
yeah.
But we stare at our dogs and cats' eyes a lot.
So how do you not notice that they're glow in the dark yellow?
And that's, and I can even get past not noticing the skin also color changing because, again, there's fur, but hard on their bellies not to notice it because they always want belly rubs and, well, except
Yeah,
cats,
the
unless they're
flaps of their
weird.
ears. Yeah, things like
Yeah.
that.
So
Like,
that one is
yeah,
always a little hard. Be like, well, how long has, this been going on? And they're like, what do you mean? I'm like, it's yellow. And they
yeah.
look at you with horrified looks. And I'm like, okay.
Well, he hasn't had a bath in like a couple weeks.
This wasn't a
Okay.
couple of weeks. This is over months. This is over
Yeah,
months, but
yeah. No, I walked into, with this situation, I walked into an exam room with a client who presented their dog for an annual exam and vaccines. I looked at the chart before I went in the room. The pet had dropped 7 pounds since its last visit 6 months prior to that, right? So I walk in the room, and immediately, I didn't even have to look, Joyce. When I got in the room, I was like I think he's seen it on my face. I'm tell like the dog's lips, ear flaps, skin,
yeah,
everything was highlighter yellow, bro.
highlighter.
Highlighter yellow. He's like, yeah, she's lost a little bit of weight. She's slowed down in eating. She's vomited a couple times, but she's due for her vaccines and a toenail trim. So we want to go ahead and get that done today. I said, honey, that's not happening. We're not doing vaccines today. I said, and here's why.
Mhm.
And I walked him through the whole body and everything that was yellow and why this could be occurring. And he's like,
Yeah.
so it's a bad idea to do vaccines?
Yes.
It
Forest
it is.
trees, my guy. Forest
It is.
trees.
It is.
Or
It is.
forest trees. There we go. That one, and then okay, we're gonna go with you don't notice skin and color change, but smell.
Yes.
We're gonna go with teeth because anybody that has worked with me knows that I can do anything in the veterinary world except for teeth. So if you are going to become a certified veterinary technician, you have to do like an externship, right? On that externship, you have to do a dental and you get graded. I was the longest dental. Dentals, Amber, that you're gonna have to because this is the one and only time I ever really did a dental. Or what, like a half hour, give
Give
or
her.
take, hour and a half. It was an hour and a half for me. You want to know why? Because I was gagging and the whole entire time because it was a dachshund mouth and was my first
Oh,
dental. And they were like, so you're technically supposed to do like four of these, and like I turned white. And they were like, can we just grade you a C on this? And I said, yes,
I'll take
yes, you
it.
can.
Have a nice day.
And she's like, we're gonna just have you do anesthesia. Can you handle that? I'm like, oh no, I don't know if I can.
Oh,
But that being said, smell from a mouth of rotting teeth. How? Because they
and
kiss,
you're
they lick you, and they smell
all
like
over your face.
both cats and dogs. Like, you can't say that you don't let. You know what? Allie's not a big licker. She never licks my face, but she'll come sniff, and I'll put my face up next to her and give her kisses on her cheek and things like that. But like, again, you would smell the rotting teeth. It is a very distinct rancid smell.
Right. And especially in your dogs that's got like advanced dental disease and probably need like radical extractions, you know what I'm saying? You walk into an
Yeah.
exam room and they're all over their pet parent and you can smell, like the smell, the nasty dental disease smell. And you go to get a TPR, you go to check their mucous membranes and you lift up that lip and like so much gum recession and plaque and hair. right? And then you like accidentally squeeze by that carnasal and then just the cottage cheese
Just
pours
stop.
out of it.
Oh,
Yeah, you know what I'm
thank you
talking
so
about?
much.
And then the pus comes behind it and then it abscesses out the cheek. And then the owner's like, oh my God, does he have bad
I'm
teeth?
so
You
hot
can't
right
smell that
now.
shit?
Stop it.
I
I'm
have
so
that effect,
warm.
Joyce. I've been told I have that effect.
I'm so warm right now because I can. Oh my god, I can smell it.
Yep. Yep. And it bust out right underneath the eye, just and just pus, right? And the owner's like, oh my God, I didn't know his teeth were so bad. You know what I mean? But you walk in the room and it hits your nostrils and it's like, you know what I mean? And then like when you do lift that lip up to check the mucus membranes and you
Can
touch
we
it,
stop?
right? And you
We get
gotta
it.
wash your
The
hands
audience
with
gets it.
like rescue to get it to go away. I'm just trying to give you the visual. Like I'm just, you know, I want you
Oh
to
my
like
god, I am
visually smell it.
sweating. I am sweating.
I've been told I have that effect, Joyce. It's the first time I've ever had it on you, though. Feel privileged.
Oh my god, like you
Holy
don't understand.
shit.
I was so cold. I am so
Yeah,
warm, but I can't
see?
turn a fan on because it would be too much interference. I'm
Mm-hmm.
sweating.
I got
So yeah,
chills,
we're gonna
bro.
move on. What else? What else, Amber? God, need a
Skin
second.
infections, ear infections, like all of it. It goes along with the smell. Like, how do you not know? Like, I had this guy the other day, okay? I walked into the room and you could, like, it smelled like Pseudomonas, bro. It wasn't, but it was like, the fuck is that, right? So I go in there. The dog was there, had a flea allergic dermatitis, right? They didn't want that addressed, right? And then he started limping a few days prior, didn't want that addressed. But we've had a little bit of problems with our ears. Like, all right,
That's what they want
okay.
addressed.
I said, a
Okay.
little bit of problems with the ears, right? And they were like, yeah. I said, has this been a chronic issue? Well, it happens from time to time. So that's a yes. I said, okay. So, Joyce, I lift up the ear flap.
Did pus come out?
Oh, it looked like cottage cheese.
Mm-hmm.
And her ear canals were closed. I couldn't even get a
Yeah.
Q-tip in there, right? Oh, this just happened yesterday. Motherfucker, this just did not happen yesterday. But first of all, how did you not notice the smell? How? Rubbing all over her face. That's not cute to me. If my dog smells like ass, don't come near me, bro. Like, seriously, like, how did you not know, one, that your dog could, like, her ears are completely closed and cauliflowered over, and that there's this
Yeah.
nasty shit that's coming out of whatever hole is still there and just like a tube of toothpaste, bro, just down the side of her face.
Well, and it's not like they're being silent about it either. It's not just like, okay, so you can't smell
No.
it. Those dogs are shaking their head, itching constantly.
Yeah. Yeah.
So, like, they're
Oh,
doing stuff out of the norm.
I didn't notice. Like, let me ask you a question, guys. Like, you have pets, right? We have to pay attention to them just as much as we do a kid. Like, if you have kids, gross, I'm sorry, but you know. Anyway, so you have to watch them like you would a child, like, and pay attention to their health because they can't tell you what's wrong. They can't tell you what hurts. They can't be like, oh my God, you know what I'm saying? Like, my feet stink, mom, help me. You have to pay attention to these things. But how do you, I understand life gets busy and shit like that, but how do you just continue to go with these smells radiating off your animal, with the stilettos that you hear as they're walking across the floor? Like, how do you not notice this shit? Like, I know life gets busy. I know this, but like, that's all I got. That's all I got. And then we walk into an exam room and we're the asshole because we see A, B, C, D, E, F, G, and the rest of the alphabet that's wrong with your dog or your
Yeah.
cat, you know? I had a cat one time I walked in, dude. I could smell it. They're like, yeah, she smelled a little funky for a couple days. Bro, she had maggots coming out of her asshole. Like, how do you not tapeworms, homie, maggots? How do you not see
Maggots.
that? And she's, I mean, ugh, it smelled like an episode of the first 48, my guy. Like, how do you not notice that?
Yeah. Now, the one thing that I can give an owner for not knowing something's wrong, you know, one of the people that had put it on TikTok was like the pendulous abdomen, right? You just
Yeah,
think your pet's getting fat. I can give that
exactly.
to you
Yep,
guys. And basically,
100%.
for people that watch this that don't know, you know, it's we're gonna picture a dachshund. Everybody knows how like flat they are and like how svelte they can be, right? In their abdomen. Well, then all of a sudden, as they get older, certain disease processes will make that abdomen drop and almost look like like they just it swings a little bit, right? So several things can cause that. We can range from, you know, one disease process all the way up to cancer. But like that's the only like that's one of the few things I can give an owner for not
Yeah,
noticing on their pet because they're like,
100%.
oh, well, a Fluffy gained weight.
Yeah.
Well, you're not entirely wrong, but it's
But
not
why
just
and
because
how?
it is just
Right.
it's not because of food. You know, we need to
Right.
do X, Y, and Z to figure out why. So I can give that one to an owner for just thinking Fluffy got fat.
Yeah, I mean, there's a lot of things I'm sure that we could give to the owner, but a lot of the obvious things, it's like, and then like I said, we become the jerks when we go into the room and we find all these things, whether we're the doctor, the tech assistant, or whatever. You're just trying to get money out of me. No,
No.
we're trying to take care of you. We're supposed to be, forgive me for being cheesy, but we're supposed to be their voice. You know what I mean? We're just telling you that, hey, their mouth hurts, their breath is stank, their ass is stank, their skin is falling off.
Yeah.
They got a tumor the size of an orange hanging off their shit. You know what I mean? But
Yeah.
then sometimes, like, they're super thankful for it. Like, I had this one patient, dude, I'll never forget this guy. His name was Clyde. He was a poodle. That was my homie, bro. And his mom did everything under the sun for him. This dog was so fucking spoiled, right? But she fed him Iams. Okay, Iams is a throwback food. Everybody used to use it. Still a good food. I will die on that hill, right? Well, a Blue Buffalo rep was at the pet store and made her feel like absolute shit because she fed her dog Iams.
I
So
fed
she
my dog
transitioned.
during the dog chow. Like, come on, people.
Exactly. So she switched him over to Blue Buffalo, right? I'm not calling anybody out, no brands, nothing like that to say anything bad, but the Blue Buffalo did not sit right with him. And he ended up like she brought him in. He hadn't been groomed. It was chilly out. And I gave him a hug, Joyce, and this dog was bones, absolute
Oh,
bones. And I'm like, is he okay? She's like, yeah, he's been all right, but he's pooping more than normal and he's always hungry. And anyway, long story short, when she transitioned him over to completely on the Blue Buffalo, it destroyed his pancreas. He had pancreatic insufficiency. It fucked him up so bad. He ended up on pancreatic enzymes and all kind of shit for the rest of
hmm
his life and could never maintain a good weight. Like it
yeah.
screwed him up bad. And like that, I hugged him when he came, not even for like a genuine, like for a full on appointment. And I just gave him a hug and I'm like, he needs to see doctor like now. You know what I
Yeah.
mean? Like, I don't know. I don't know. Needless to say, I had a conversation with the Blue Buffalo rep at the pet store. Just saying.
It's the same. Like, I'm going to turn on my turn signal and go to like a little bit of a lane change. It's like when the people at pet stores that say goat's milk is good for pets. I will throw hands. I will throw hands. I have seen,
Mm-hmm.
and you know what? I'm gonna have people probably in the comments that say I've fed my pet goat's milk for years and it's done wonders. Kudos to you. I have seen more harm than good.
Yep. Yeah.
More
And
harm
I'm
than
gonna
good
get in.
from fucking goat's milk. They are not meant to consume goat's milk.
Yeah.
They're
Yep.
not. They're not meant to
If they were, they'd have
consume
been born goats.
dairy.
You
They're
know?
dogs.
Yeah. No shit. And I'm gonna stay in that lane chain with you. Speaking of the pet stores telling people shit. Same pet store had the manager. Okay. I went in there and I seen one of my clients was like one of our clients was there with their patient, and I said hi, da 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 da, and we went on about our business. Well, she's like, she was looking for an ear wash, and the guy was trying to help. He's like, well, what do you got going on? She's like, she's shaking her head and she's digging at her ears, and I'm not trying to listen, but I'm listening because it's my patient. You know what I mean?
Yeah.
And he's like, well, she's probably got ear mites. One, very well taken care of dog. I mean, spoiled as shit. So there's no fucking way this dog had ear mites, right? Two, she's an Australian Shepherd, Joyce. She's an Australian Shepherd. So you know what he tells her to do? Go to the feed store and buy a bottle of ivermectin and just shoot that in her ears. I came unhinged. Needless to say, I couldn't go back in that pet store for quite a long time. Gladly so,
Mhm.
but it was not a good situation. I said some things.
Well,
Then,
yeah, because that dog could have gone into a seizure.
yep, I said some things, and everybody knew where I worked. But that's okay.
That's okay.
Anyway, stick up for your patients, bro.
Yeah,
But
pretty
yeah,
much
no,
is the moral of the story. Like, we've all been judged by the owners that we point out things and made to feel like we are nickel and diming them because we found X, Y, and Z, and I'm going to say I thankfully haven't experienced too much of that because I haven't done, and I feel like day practice and general practice and that deal with that more
hmm
because by the time they come to specialty and emergency, they've already gone through a certain gambit of tests to get to
yeah,
where I was at. And so like I feel like you know, our DVMs and everything get that more when they point out X, Y, and Z on Fluffy. And then the
yeah,
owners are going to be feeling judged. And I mean, a little bit, I'm not going to lie, a little bit. It makes
yeah,
us scratch our heads. I'm not going to lie that you didn't
hmm
notice.
yeah.
But also,
You know,
that's also what we're trained to do is notice all the little things. And if we didn't notice that, we need more training.
yeah. That's what we're there for. Like I said, that cheesy line, like be their voice, you know what I mean? Like we are supposed to find those things because they can't tell us where it hurts. They can't tell us what's bothering them. They can't, vocalize, hey, this has been hurting me. This has been bothering me. Can you check this out? It's our job to pick up on that stuff immediately. It's our
Yeah.
job. Like our job starts when they walk through the door. Our reception team, or when we call them back to come in the room, we should be watching how they walk. We should be watching how they ambulate. Are they struggling? Are they having issues? Are they, having respiratory concerns as they're walking? Like we need to look at our patient as a whole, and it's our job to find those things. It's our
Yeah.
job. If we don't find those things, if our doctors don't find their things, they're not doing their job. They're not advocating for your patients. And why are you paying for a physical exam if we're not examining them and finding the things that we need to take care of? It's not because we're
Yep.
trying to rack up your bill. It's our job to find those things and be like, hey, this is what's going on with your pet. This is what we should do about it. And it's up to you to approve or decline those things. You don't have to do it all.
No.
We can stair step and address one thing at a time. If we find 15
Yeah.
different things, we address the most immediate problems and we work our way through the rest. I take rest. It makes me
But yeah.
angry. They're like, oh my God, you're just trying to get money out of me. Bitch, this ain't a car dealership. I get paid whether you buy that or not. Whether you do
Yeah.
that treatment or not, I still get paid. I don't get commission, bitch.
No.
Sorry.
On
It's
that note,
cold. I've been stuck in the house all day.
I've been stuck in the house, but it's been a 10 out of 10 for me because it doesn't happen very often,
I
except for the past 2 weekends.
have ADHD and I've had a lot of caffeine, so
Yeah. I've had to cut back on my caffeine because I went a little bit. But any hopes, guys. Hope you enjoyed this week's episode, and we'll be back to our regularly scheduled programming, barring Mother Nature's wrath in North Carolina. Yeah.
yeah, yeah.
Until next week, guys.
Be safe, make
Bye.
good choices.
Don't make good choices. Cause mayhem.